Have you ever felt short of breath when doing the simplest tasks? It can be alarming and frustrating, especially when you don't know why it's happening. Millions of people experience this feeling, and for many, it could signal a condition known as chronic obstructive pulmonary disease, or COPD. But what exactly does this mean for you? In this video, we'll dive deep into a critical tool that doctors use to diagnose this condition, the flow volume loop test. By the end of this discussion, you'll not only understand what this test involves but also how it can make a significant difference in your health. What is COPD? COPD is not just a single condition, it's a group of diseases that cause airflow blockage and breathing-related problems. This condition can manifest as chronic bronchitis, emphysema, or even asthma, leading to symptoms like wheezing, chronic coughing, and debilitating shortness of breath. With around 15.7 million people diagnosed with COPD in the United States alone, it's crucial to identify this condition early. Understanding COPD can feel like navigating a maze, but fear not, we have the tools to guide you. The Flow Volume Loop Test, your window to lung health. The Flow Volume Loop Test is like a roadmap for your lungs, charting the airflow and volume of air you can move in and out. Imagine your lungs as a balloon. When you blow air into it, you can feel it expand. The Flow Volume Loop Test measures how well you can fill that balloon and then empty it. This test assesses the airflow in liters per second and the lung volume in liters, helping doctors determine if your lungs are functioning normally or if there's a problem. Preparing for the test. If you're scheduled for a flow volume loop test, you might wonder what to expect. Preparation is key to ensuring accurate results. Before the test, your doctor might recommend that you stop using certain inhalers or medications. Wear loose-fitting clothing to help you breathe comfortably. Avoid large meals, as a full stomach can hinder lung expansion. When you arrive for the test, a pulmonary function specialist will guide you through the process. You'll be seated upright with a clip on your nostrils to ensure all breathing is done through your mouth. It's essential to keep your lips sealed around the mouthpiece so that the airflow can be measured accurately. What happens during the test? During the test, you'll take a deep breath in, then exhale forcefully into the spirometer, a device that measures your breathing. You'll likely perform this action multiple times to ensure consistent and reliable results. The test is quick and should not cause you any pain or discomfort. Think of it as a routine checkup for your lungs, much like a car inspection to make sure everything is running smoothly. Interpreting the results. Once the test is complete, your doctor will analyze the flow volume loop results. Here's how they interpret the findings. 1. Normal results. If your results fall within the expected range, it means your lungs are functioning well. Great news. 2. Obstructive disorders. If your airflow is lower than expected, particularly during exhalation, it may suggest an obstructive disorder like asthma, emphysema, or COPD. This means your airways are narrower than they should be, making it difficult to breathe. 3. Restrictive disorders. If you have a lower than expected lung volume but a normal airflow, this may indicate a restrictive disorder. Conditions like interstitial lung disease or kyphoscoliosis can restrict lung expansion. 4. Fixed obstruction. This result indicates equal airflow limitation during both inhalation and exhalation, which could suggest conditions like tracheal stenosis. 5. Variable extrathoracic obstruction. This result points to issues with the vocal cords, such as unilateral vocal cord paralysis, impacting your ability to breathe freely. 6. Variable intrathoracic obstruction. This could indicate tracheomalacia, where the trachea collapses during exhalation, affecting airflow. Next steps after testing. If your results suggest that you may have COPD, your doctor won't stop there. They'll likely recommend further testing to assess the severity of the condition. This may include a breathlessness questionnaire, to evaluate how much breathlessness impacts your daily life. A 6-minute walk test, This measures how far you can walk in 6 minutes and assesses your lung function during physical activity. Blood tests, these help to identify comorbidities related to COPD, like infections or anemia. Imaging tests, chest X-rays and CT scans can reveal underlying causes of COPD and help assess lung damage. Treatment options for COPD. If diagnosed with COPD, remember that you are not alone, and there are ways to manage this condition effectively. Treatment may involve lifestyle changes, such as quitting smoking, which is the leading cause of COPD. Participating in lung rehabilitation programs can also be beneficial. These programs combine exercise, education, and behavioral modifications to help you manage your condition and improve your quality of life. Medications can play a crucial role as well. Bronchodilators help relax the muscles around the airways, making breathing easier. Corticosteroids are often prescribed to reduce inflammation in the lungs. By working closely with your healthcare team, you can create a personalized treatment plan that fits your needs. The importance of early diagnosis. Understanding the flow volume loop test and its implications can empower you to take charge of your respiratory health. Early diagnosis of COPD is essential for effective management. If you experience persistent symptoms like chronic cough, wheezing, or shortness of breath, don't hesitate to seek medical advice. Your lungs deserve the best care possible. Conclusion. In summary, the flow volume loop test is an invaluable tool in diagnosing COPD and other respiratory conditions. It measures how effectively your lungs can move air in relation to their volume, helping doctors understand what might be causing your breathing difficulties. Remember, if you're feeling out of breath, it's not just a sign of aging or being out of shape, it could be something more. By knowing about flow volume loop tests and COPD, you're better equipped to advocate for your health. Don't wait for the symptoms to worsen, seek help early and take steps toward better lung health. Your journey to understanding your breathing begins here. Stay informed, stay proactive, and remember, your breath matters.